Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind. So it's time to disrupt the status quo, to challenge a system that fragments care, dehumanizes patients, and burns out clinicians. I'm Dr. Georgine Nanos, and this is The Kind Revolution, a podcast about breaking old paradigms, rebuilding medicine with compassion and science, and reimagining what healthcare can be when we finally get it right. Because change is here and it's starting with us. Welcome to the revolution. I am so honored today to have a very special guest, Dr. Mohammed Abdul Hamid. He is a board certified neurosurgeon and the founder of Royal Spine Surgery in Scottsdale, Arizona. He specializes in minimally invasive spine surgery and is recognized for pioneering a more holistic approach to spine care, combining surgical expertise with non-invasive technologies such as HIFEM and radio frequency for functional wellness, mobility, and recovery. Dr. Abdul Hamid is also a clinical researcher, a keynote speaker, a medical legal expert whose insights have guided both patient care and legal decision-making nationwide. His work bridges innovation, compassion, and empowering patients through transparency, knowledge, and trust. And he's also a great friend of mine. Welcome, Dr. A. Can you share a little bit about your background and what led you to launch Royal Spine Surgery?
I grew up in overseas in Saudi Arabia. And then at the age of 17, 18, finished high school there, and I decided, I'm gonna go for med school. So actually, my first stop was in Europe. I was enrolled in med school in Europe in the Czech Republic, and then after that, transferred to the U.S. And back then, I was supposed to go to Ohio State, but there was a mix-up in the application, so I ended up going to Iowa State instead. So I did my undergrad at Iowa State University, biochemistry, biophysics, molecular biology, and then went to University of Iowa for medical school. Then went to Syracuse, New York for my residency training, neurosurgery training. And then from there, we went to Miami for fellowship spine surgery. After Miami, came to Scottsdale, we fell in love with it, and we've been here since then. How I came up to create Royal Spine Surgery. So when I moved out to Scottsdale, I was actually part of a group doing brain and spine surgery primarily. But then I realized that there is something about the way we provided care, and we still do, that didn't sit too well with me. At that time, I felt like my job was really just to screen MRIs and pictures, and based on that, decide who needs surgery and who doesn't. So I didn't feel like I was part of like the patient journey in ways that I felt that I can actually leave a huge impact. So part of me designing Royal Spine Surgery was for me to offer something that I wanted for my own self and my own family, which is really the education. One of the things that I struggled with back then is I just did not feel like I had enough time to make my patient educated about their condition enough and empower them so they can make informed decision and understand why they need surgery or why they don't need it. And if they did need the surgery, that is not just the end of it, that there is stuff that comes after that we still have to address. But when you see a patient, when you're only given 5 to 10 minutes to see a patient, you cannot achieve all of that in that short window of time. And I also realized that a lot of time, the reason why some patients might feel like my spine surgery failed or it didn't work, maybe not necessarily because the surgery didn't work, but I think it has to do with the fact that the expectations, they were not on the same wavelength. Like the surgeon might have offered the surgery for a specific indication, while the patient assumed that he was going to do all these things, all these wonderful things. And so they had their expectations set at a different level than the reality. And I think because there was not enough time to communicate that very well to the patient in a way that they could understand it and appreciate it, it will leave these patients with a sense of dissatisfaction or even a sense of loss. Like I thought they was going to do all of these things and it didn't. And then they say that it failed, when in reality, it really didn't fail. It did address the neurological issue or the spinal issue, but the expectations were not on the same wavelength. And that's what I came up with. I said, I want to do Royal Spine Surgery where I can do things a little differently, spend enough time with my patient, and then do the things that I want to do, not do the things that a health insurance would want me to do, for example.
Yeah, that definitely resonates. I know with a lot of doctors out there trying to get out of the insurance-based model, which really restricts how we want to practice and take care of patients in the best way possible as doctors. That's why we got into this to help people, right?
Yep, exactly, 100%.
So you've said, surgery alone isn't often enough. So what does this functional holistic approach look like in your practice? Walk me through it.
So the notion that, in my opinion, there are some cases where surgery is inevitable and it's required and needed. You talk about infection, tumors, trauma, fracture, a neurological compromise, someone who now has like, paralysis, severe sciatica where the leg isn't working. Those are different things. But we're talking about the most common reason why people are having surgery, which is the word degenerative spine disease, which is the wear and tear stuff. In my opinion, that process has started at some point in time. And by the time they get to the surgeon, you're only seeing the end result of that progression. And the reality is this, if we assume that that condition had to do with wear and tear and age-related changes, we know we cannot stop the chronological clock. We cannot reverse it, we cannot stop it. So aging will continue to happen. Therefore, it's important for this patient to understand when we're doing surgery for those indications, it's not going to bring you back a normal, healthy spine again. If you're at the age of 55, your spine is 55 years old, just like you're 55 years old. That surgery isn't going to make that spine go back to 25. It's still going to be 55. And therefore, the surgery now is intended to minimize discomfort, minimize pain, improve function. But the notion that you're going to have a brand new spine and a brand new body is not accurate. Therefore, what I want to do is I look at the root causes. What are the things that have led to the patient getting to this point? Because majority of patients, we see majority of people actually, they will have degenerative changes in the spine, but they won't have problem from those. As a matter of fact, there are research and studies that is showing that for every decade of life, the prevalence of noticing changes on the MRI or CAT scan that we call degenerative changes will go up. By the age of 90, 98% of people at the age of 90, they'll have findings on the MRI consistent with degenerative changes, even though they have no symptoms. So then you have to ask yourself the question, why is it some people will develop then symptoms as a result of this degenerative changes that happen over time? So now we look into these other factors. Is it muscle mass issue? Is it fat infiltration issues? Is it their habit, their diet, their activities? There are sometimes when genetics factors can play a role. And that's kind of my approach is just look at the things that might have contributed to this condition. But more importantly, let's address them because if we don't address them now, this degenerative process will continue to happen. And now you're going to need your second surgery and your third surgery. And that's I think where the philosophy is a little different. We don't look at surgery as the end in itself, but we look at it as it's a way for us to start to educate the patient. You gotta make a change, and the surgery might have been that point in their life journey for them to look at their life differently.
I think that's such a unique perspective, especially in the field of neurosurgery and spine surgery. Coming from the primary care side, not being surgeons, we focus a lot on these other aspects of getting people's spine health and neurological health in order, but it is so challenging, and often it seems very binary to do, either one or the other. So I think that you're
Yeah.
combining the two is just it offers so much to patients. Let's talk a little bit about Emsculpt Neo functional protocols and some of these energy-based approaches, which I think are it's really the cutting edge of medicine now. And I know you're the world leader in this. So let's kind of unpack it all from the start, what Emsculpt is, what Neo is, and how this all came about and how it can be applied.
So I guess maybe I'll start with how it came about, and then we'll go into the science because the story behind it is an interesting one because it was coincidental. Not I didn't know anything about Emsculpt Neo or any of these devices. But again, everything happens for a reason. So COVID hits. Everyone, obviously with COVID, everyone is afraid. They don't want to be exposed to COVID. And at that point in time, as someone who believes in the importance of rehabilitation after any surgical procedure, because I view surgery as an invasive traumatic event, stressful event to the mind and body, by the way. It's not just the body, but mind and body. So therefore, I always send my patient for physical therapy. And what I tell my patients, if you go to the dentist, they can do a root canal on you, but they still ask you and expect you to brush your teeth. You don't give up your toothbrush. Physical therapy to keep these muscles moving and active is the toothbrush for your spine and your joints, right? So I always send my patient for physical therapy. Coming from that belief and understanding the importance of rehabbing muscles after surgical procedures, I always tell my patient you're going to need physical therapy no matter what, whether it's minimal invasive or maximal invasive. Any surgical procedure, I put him through physical therapy. COVID hits, no one wanted to do that because of fear of exposure. And I knew that was going to compromise on the patient's over, long-term outcome. And I was against my principles anyway. So therefore, I was like, there has got to be something in this 21st century that might actually do that maybe in my office. So I started, going online, looking up things, researching things. And then I came across this Emsculpt Neo device that I didn't know anything about. So I became intrigued when I heard about it helping with muscles and reducing fat. Like, wait a minute, they're talking about the structures that I've recognized they are involved to some extent. In most cases, there actually might be actually factors in creating chronic back pain issues. Called the company, said I want to learn more about it. So I did my investigation and started digging more and more into the science, electromagnetic science, and how that works. And I realized that it's not new, it's old, but BTL took it and perfected it in ways that made this device unique and different. And that's fine, guys. If that device does what you say it does, which is helping build muscle, rehabbing muscles, and burning fat, why couldn't we use it for people after spinal procedures for the recovery? And it started as a thought. I knew the science was there. It was just a matter of prove it. And to prove it, you have to now apply it to your clinical setting. So I buy my first device and I started telling my patient, hey, listen, I have this idea. This device, it's non-invasive. It's not going to harm you by all means. And if it doesn't do what I think it will do in terms of recovery, at minimum, no one is going to complain about shaving some fat off of their body and maybe getting like their body contoured to some extent. So that's how it really started. And from there, we started just keeping track of the data, seeing how people responded in terms of muscle strength, in terms of pain reduction, range of motion, quality of life. And then from there, we're like, listen, this cannot be coincident because it is now almost daily we see these results happening with patients that we treated. And that led us to finally, in partnering with BTL to say, let's just do a clinical research and multi-center research, IRB approved. So it's not just me, but there are also different sites. And we did that blindly with different sites. And all sites came back with the same observation we had, which is this thing is actually helping people beyond just body contouring. And that's led to the FDA clearance. And that's how we got from, hey, it was just an idea, to now clinical application and using this device now for in more, I guess, arenas than just the aesthetics, body sculpting, weight loss area.
I love that story. And I love that you were able to come up with this unique concept and put it into practice and partner with such a great company that can actually execute it and bring it to market in such a powerful way for so many people. Let's talk a little bit for our listeners out there who are curious if, they would be a good candidate. Let's talk about what kind of patients benefit most from this. Is it just post-op? Is it also preventative? Like, what do you see in everyday practice? Give me a few examples.
So I would say the general statement, when patient ask me that question, I tell them who would benefit from brushing their teeth? Everyone. So the short answer, everyone will benefit from it because muscle health, we now know, is very crucial for longevity. Having muscle mass, muscle strength, fighting sarcopenia. The stronger your muscles are, the higher chances that you're going to have better longevity over time. That's just a fact about muscles. So working on muscles is always going to be great. Now, someone can make an argument. So how is that compared? I go to the gym, I'm fit, I exercise, and that's great. I'm not saying replace those things. Keep doing those things. But what makes this device unique and different is the way it's activating these muscles. It's more of a passive treatment. So we'll dive into that. For example, If I go to the gym, I have to be an active participant. My muscles are not going to do any workout if I personally don't do the work. I have to do the lifting, I have to do the squatting, the deadlift. And when doing so, even though my goal is strengthen the muscle, it comes at the expense of potentially joint overuse, right? So that is point one. The device eliminates that because the patient is not doing an active engagement. Instead, the machine is delivering all the energy. The machine is activating the muscles even when the individual doesn't want to do it. It's very powerful. It's going to activate these muscles even against your own will. But at the same time, because you're not doing the work, there is not stress to your joints. So when you work on your quads, for example, the machine activates the quad muscles, but you're not stressing your knees. You're not putting weight on your knees, which is important to salvage or protect your knee joint, especially in patients and individuals that already have knee problems. Or maybe someone who had surgery, knee surgery, and they're being told, don't put weight on your leg. Well, how are they gonna exercise and strengthen their leg during that post-operative recovery period? So this becomes a great tool to do that because we can bypass the concern about stressing the joints, right? So with that mentality, anyone who wants to invest in muscle health, whether just general population, the person who likes to play golf, the person who wants to just walk and hike, person who wants to swim, professional athletes, college athletes, people before surgery, even before surgery, to optimize your overall condition so you're prepared for surgery. I used to tell my patients, you wouldn't run a marathon without training for it. But we have you go through surgery without training for it. And that's how do I train for surgery? Well, mind and body, lowering stress level, optimizing your medical condition, and optimizing your muscular health. All of these things make the surgery easier to go through and the recovery faster to achieve. So it's pretty much literally for everyone. Everyone will benefit from it as long as, they meet the inclusion criteria.
Let's talk a little bit about the functional protocol that we use on the actual joints as opposed to the muscles, and how that has kind of changed the way we address chronic pain and some of these typically really difficult to treat conditions like sciatica and the like. Walk me through what that looks like.
So the machine is unique because the HIFEM, which is high intensity focused electromagnetic energy. Make it simple, it's a magnetic energy that penetrates through the tissue to the deeper layer, muscular layer, as well as the nerves. And through changes in the magnetic field, it can cause depolarization of the nerves, which causes the nerve to send electrical signal or the nerve to fire. The nerve firing is what's going to cause muscle contractions. But the machine, we can control the strength, the number, the frequency of these stimulations. And by changing those parameters, we can achieve a sculpting mode or a functional mode. So those are the two main modes. The sculpting mode was the original mode, and that's the mode that is intended for building muscles. So it's going to be an aggressive mode because it's going to deliver more pulses, more powerful pulses, and therefore stronger muscle contractions. They're great for people that are wanting to build muscles, athletes, someone who's just wanting to
Or
get their muscle mass
strengthening. Yeah.
strengthening and so forth. Now, that might not be a good idea for someone who just had an injury. Because let's a simple example is running, right? And they get cramps in their leg. Their calf is cramping on them. When you have a cramp on your calf, what is the first thing you try to do to make it feel better? Stretch it, relax, release it. You don't expect that person who just had a cramp in their leg to say, hey, no, I want you to get up and keep running. The muscles
Right.
can do that, right? So that's where the functional comes in. The functional, same magnet, but different parameters that are now not causing these supramaximum muscle contractions that are intended to make the muscle work harder, but instead they're intended to actually relax, stretch the muscle, help the muscle recover. And so in deciding how we treat, you got to decide at what stage the muscle that you're targeting, is it really in the stage of injury, spasm, stiffness, tightness, where the goal is to release those things We call it muscle inhibition. Are the muscles inhibited from an injury, trauma, surgery, and so forth? Then you need to release those muscles. You're going to do the function. But then are the muscles weak and I need to build them, that they're going to do the sculpting. And sometimes we could do combinations. So for example, for most of my patients, we will start with the functional, since most of them they're coming to my clinic with already musculoskeletal condition, spinal condition. So we're going to start with that as the phase to like prime the muscle, relax the muscle, prep the muscles, get him out of the inhibition phase, the tightness, spasm, stiffness, which by the way will also improve range of motion. Because if you help release the muscles, the range of motion will improve, which means they're able to be more active as well. And then we switch to the sculpting mode as part of now let's build onto that and enhance that physical resilience. So that's how we look at the two modes. It's the same magnet, same machine, but it's the software and the physics behind it that makes the difference.
So give me some of your the top 5 applications where you would use the functional protocol, like the common everyday things that you would treat that maybe beyond not just the post-op recovery, but people where we can use it outside of neurosurgery, say in primary care or something like that, or patients who are, don't want to be constantly taking pain meds or, have exhausted all their PT options and really feel like they're at their end of their rope. Where do you see it most applicable to some of these common or more common everyday conditions?
I would say like a common condition, someone who might have slept the wrong way or lifted an object the wrong way, and now they actually strain their muscles, and they feel like, oh, I pulled the muscles, my muscles feel like tight, and I pull the muscle.
Like
That's a
in your neck or
great
your
one.
lower back or something like that?
Yeah, someone, let's say, like, they pulled their hamstrings, right? Or they were like, they sat the wrong way, they lifted, a bag the wrong way, and oh, I pulled my muscle in my lower back or my glute is feeling tight. That would be a great one. I have few patients that, we live in a golfing community. They might be playing golf and swinging the golf club, and now they feel, oh, I twisted the wrong way, and now my muscle is tight. And so we target those areas. So that's going to be the most common one we're going to see. There are people that come to us who might have had, for example, you mentioned the word sciatica earlier. And with sciatica, it's a little different because with sciatica, you have to do a deeper evaluation, look at the MRI, find out what's the source of the sciatica. Is there a disc protrusion, impingement of the nerve or no? And to what extent? But even when there is a impingement of the nerve root, you can still help those muscles. Because one observation you'll see with muscles or how muscles generally behave when there is pain, regardless of the source of the pain, whether it's pinched nerve or a fracture or inflammation, when you have pain, the muscles will go into an inhibition mode as an attempt to guard and protect that area. So if you actually, when you have sciatica and that nerve root is irritated, the muscles on your back and your legs will go into an inhibition mode where they start to get into spasm, stiffness, and tightness. And that's designed as a defensive mechanism because your body realized by creating the stiffness, I'm going to limit your range of motion. And why do I want to limit your range of motion? Because I don't want you to move the wrong way and causing further damage to that nerve or further damage to that disc herniation. So it becomes a protective mechanism. So there's always a muscular component or muscle inhibition to injuries and musculoskeletal pain. So the functional will help ease the pain, even in cases where I feel someone is going to end up needing surgery. But by the time we're going to get that patient to perform the surgery, it might take us a few weeks. Medical clearance, optimization, all this other stuff. But the patient is in pain. How do I reduce that pain and improve their function? By working on those inhibited muscles. And that's one of the beauty of this functional modality. I'm able to get the pain reduced as we're waiting to actually address the root cause of that problem. So that's one area where we do it. We talked obviously about before surgery and definitely after surgery. Here's something about after surgery. I used to wait for at least 2, usually 4 weeks from surgery before we start physical therapy. Primarily because patients might still be uncomfortable, and some of them are actually fearful of going back to doing things soon after surgery because they feel in their head this might actually ruin it. So I just adapted the idea that, okay, we're going to give you 4 weeks to let things settle down before we do physical therapy. Now with the Neo, we wait for a week. A week after surgery, we can actually start that because they're not really physically doing anything that could potentially harm them. So the idea that I'm going to do something that's going to make it worse is pretty much eliminated here because they're laying down and the device work on the muscles we're targeting. So it's a great tool for me in the post-operative phase. We talked about preoperative. We talked about example of sciatica. An everyday example would be what we talked about. I pull the muscles and I need to get rid of it. People have chronic pain. So someone has like chronic pain, assuming they don't have like a specific condition such as instability or some of these surgical conditions. We can also help these people with chronic pain by start targeting these muscles because they go into inhibition mode. And by working on them frequently, and we design multiple sessions, we start to actually retrain these muscles. Part of the FDA clearance, one of the FDA clearance, well, there are 6 of them, but one of them is muscle re-education. And that's what we mean by that muscular re-education. Muscle adapted this inhibited mode for a long time, resulting in limited range of motion and pain. The technology, by using technology, we're re-educating these muscles. So they start to get out of that inhibited mode over time.
I think that the application for chronic pain is so desperately needed in medicine today. We've seen over the last couple of decades what the opioid crisis has created, what has come from trying to treat chronic pain without any great solutions. So having something like this that's so powerful is really game changing, I think, in medicine in general. Can you share maybe a case or a patient story that stands out, someone's recovery who really turned the corner with this protocol, maybe with chronic pain that was otherwise really challenging?
Yeah, I mean, I can think, I mean, there are many of them, but off the top of my head, I can think of maybe 2 examples that come to my mind. One, a lady who actually came in from Colorado, and she suffered from chronic back pain for 6, 7 years. But then 3 months or 2 months before she came for the evaluation, things progressed rapidly. And then she developed sciatica on top of the chronic low back pain, and it became debilitating. She was, a single woman, no support, on the verge of losing her job, losing her business essentially because she couldn't do the job. Came for the evaluation, did the evaluation, determined, yeah, she had a disc herniation, wasn't large, but it was enough where it was kind of like irritating the nerve and causing the sciatica, but she also had the chronic back pain. Now, the interesting thing, and this was actually one of the earlier patients that we were actually treating. At that point in time, my thought process was like, well, it looks like you're probably gonna end up needing surgery because there's something like, close to your nerve rubbing on your nerve. We think you're gonna need surgery. By the time we get you ready for surgery, get your labs and have you see your doctors, that might take us a week or two before we get things in place. What do we lose if we just try this? Let's just have you do the machine. It's not invasive. There is no needles, no chemicals, no pills, no downtime. Just lay down and the device will do the work for you. So we started her on the program. I remember we started on a Tuesday because Monday was a holiday. I forgot which holiday. So we started on a Tuesday. And we did our first session Tuesday. And then she came back Thursday that week, 2 days later. And then the first thing she told me, doctor, for the first time I slept for 9 hours in 6 years. And
Wow.
then she wanted to show off, and she said, let me show you something that I couldn't do for a long time. She stood up in the middle of the waiting room and she leaned forward and touched her toes. And she said, I could not do that for years. And then I was like, okay, let's just continue with the treatment. Keep in mind, all along, we're still thinking we're going to move with surgery. This is good, but she still needs the surgery. Now, one thing I forgot to mention, because of her sciatica, she also developed a foot drop. Her foot was weak and didn't have good strength, which is why I felt she's going to need the surgery. By the second, so that was on a Thursday. By the following week, Thursday, that foot drop completely resolved. And
Wow.
she had zero pain. And so then she decided this is so good, let's just continue the whole program. Because initially we were going to do it just as a preoperative optimization to help her get ready for her surgery. But now we recognize it's actually solving the problem. Now the disc herniation might still be because we didn't repeat the MRI to find out if it actually went away or no. But in terms of her pain, strength, and overall and sleep and overall function, all these metrics actually started to correct within days. So by the end of the month, she ended up actually extending her stay for a month because we ended up just doing more sessions. By the end of the month, she cried saying that you guys gave me my life back and didn't have surgery. Actually, she hasn't had surgery, and this has been almost like 2 years ago, and she still hasn't had the surgery done. So that's one of those scenarios where you can see even myself. I was like, listen, there's no way she's gonna need surgery because there is something rubbing on her nerve, and there's a foot drop. But when we see a drastic change like that, you realize that it is doing something. It's working. So that's one of the very first patient experiences that made us kind of like, believe in we need to, pursue this further and make sure that we're able to get FDA clearance and so forth. This is now showing the other extreme. So this gentleman, young guy, fit, I think he's got like 6% body fat, really like fit guy, right? The guy that, most people say, oh, this person is in good shape, they'll never have back problem, right? He developed back issue, he developed sciatica, and he had suffered from that for 7 months. And it really controlled his entire life. People who suffer from pain, especially sciatic pain, there is nothing like that compared to that pain. I mean, it is one of the debilitating thing. You can't sleep, you can't move, you can't function. Every time you look at the clock, it felt like every second feel like an eternity, right? So he actually ended up doing Emsculpt Neo at a different location with the thought process that it was going to help on its own. And remember, I said it does help with muscle inhibition. But in some cases, especially with sciatica and pinched nerve, I always look at the MRI because if there is a nerve impingement that is severe enough, then the Emsculpt Neo by itself is not going to be sufficient because now you're working against nerves that is constantly under pressure. That's going to continue to lead to denervation and atrophy. So whatever you're building on this side, you're actually taking away on this side. So he came to me for a second opinion because he said, listen, we've been doing this Neo at a different location and it's not really working. And I'm like, well, when I hear that, it's one of two things. It's either there is something we're missing in terms of the diagnosis, or maybe there is technical issue that is different. So I did my evaluation, looked at the MRI, and immediately recognized what the problem is. There was a tiny, tiny disc herniation in the foramen, which is a small, tight, small area where the nerve is coming out of the spine. But because of its location, the small, tiny fragment was enough to create enough pressure, was enough to create pressure on the nerve for him to be symptomatic. And I told him, we could do 1,000 Emsculpt Neo treatment. It's not going to change the fact that we are working against a condition where your nerve is constantly under pressure, and the Neo is helping muscles, but your muscles still need the nerves to fire. So we ended up doing surgery on him, cleaned out that fragment. Immediately after surgery, patient was able to stand straight up, pain is gone, strength started to come back. Now, that's a story where you have to be careful with assessing some of these sciatic, especially if there's neurological component, like a foot drop or something that you might feel like maybe a surgeon should evaluate this. But where the Neo came in place, here's the interesting thing. After we did that surgery, I assumed the guy would have lost faith in me and the Emsculpt Neo because he already had it before surgery and he just felt it didn't help, right? I told him, listen, I would recommend doing the Neo after surgery because whatever we did, the nerve reaction, and here is my theory. I told him, I honestly think all these treatment you had with the Emsculpt Neo prior to the surgery, they actually help because they maintain the muscle function to some extent. It didn't solve the painful condition because of the nerve, but if you didn't have the Neo, you would have probably lost muscle mass and become deconditioned. But he became a believer in the Neo, and he actually said, you know what, I agree with you. And I actually know that it actually helped me, even though it didn't resolve my problem. So he ended up doing even more Neo treatment after his surgery. And again, instead of waiting for 4 weeks, it was only 1 week, and he started doing it. And we have body composition analysis where we track their metrics. And within 4 weeks, during this episode, he dropped down. Muscle mass was going down, and he went below his normal baseline. Within 4 weeks, we did, I think the surgery was literally right after Christmas. And so by end of January, which is 30 days ago, he was already hitting metrics above the baseline.
Wow.
So his recovery was really fast, expedited.
Those are just very inspiring stories. Tell me, so one of the things that you often say is that pain is not a problem to be fixed, it's a signal to be understood. Let's talk a little bit about the mind-body connection with pain and what role chronic stress or trauma play in spinal dysfunction or chronic pain.
So I classify pain into three categories. I'll talk about nociceptive pain, which could be visceral, somatic, like pull the muscle, stomach ache, fractured bone. These are kind of be like the nociceptive pain. And then we talk about neuropathic pain, pain that is truly coming from the nerve. And that's like a sciatica, pinched nerve, a diabetic neuropathy where there's a damage to the nerve themselves. So the difference between the two, one, the pain is coming from the nerve. The nerves are involved. They're actually the problem or the root causes. The other one, the nerves are just the messenger. A toothache is a nociceptive pain. The nerve is making you feel it. They're the messenger, they're not the actual culprit. And those are the two main type of pain that, if we were to make it into general categories, these are going to be the major two ones. But the reality is this. I don't think for anyone, and I think most of us might have felt pain to some degree here or there, that there is no way to believe that when you're in pain, that pain doesn't affect the mindset. Any person who experiences pain, toothache is an example. If you have toothache, you become a different person. If you have sciatica, you become a different person. And when we say a different person, what we're really saying, your mind is different, your personality is different, right? So pain
Yeah,
ultimately,
I
yeah,
say, I tell patients like pain colors your whole world. It really like
yeah,
if it's very intense. Go ahead.
100%. You're absolutely right. I mean, people, you become a different person when you are in pain. And we hear that sometimes. Sometimes I always recommend when the patient come to the office, they bring their spouse with them. Because oftentimes you have better clues from the spouse. And oftentimes I hear the statement, my husband, my wife, they're not the same. What do
Yeah.
they mean by that? And usually I ask them, can you elaborate when you say they're not the same? And they say, well, they're not sleeping well. They're very like short fused. They get agitated quickly. They're angry. And why? And then the patient says, because doctor, I'm in pain. So now we know there is a psychological component that pain will feed into. And that's what we call psychogenic pain. So there's a psychogenic component to pain. Now, the true definition is psychogenic pain is pain that is now aggravated or precipitated by underlying psychological issues, but can be also exacerbated those underlying issues. So anytime someone comes to me with chronic pain, part of our evaluation, we have to assess their mindset, right? And there are now studies showing that if you're able to reduce the mental stress, the anxiety, the depression, the stress, all of those, that you're able to actually allow the body to maybe receive the pain to a lesser extent. That's why we recommend meditation. Some people recommend, hey, you know what, let's go and do some meditation. Let's do some relaxation. As a matter of fact, here's an interesting thought. People who have like tight muscles, and when I see patients in my office, I tell them, what have you tried for all of your back pain? And they say, doctor, I've tried medication, I've tried physical therapy, I've tried injection, but then they say, of all the things that I've tried, doctor, massage made me feel the best. And here's the interesting thing about massage. Massage, you're actually relaxing muscles. When you're doing a massage, you're essentially trying to release those inhibited muscle fibers and it feels good. The problem is it doesn't last for too long because it can come back again. But when they see it, the massage makes me feel better. Where is that feeling? It's in the mind. Even though they're touching the muscles, that act of relaxing muscle, rubbing the muscles, stretching the muscles, positively feed into their mind that this feels good, right? And then there is actually science behind that. We can dive into proprioceptive mechanism and what receptors are being activated, and it feeds into your brain, and that's why vibration feels better for the brain. There's gate control theory behind all of how this is work, which is by the way what I think how the Neo actually work. It's all through this like scientific pathways. So to go back to the mindset, I now, when I see my patients, if they have chronic pain condition, we need to, we immediately start to asking question about their mindset, mental wellness questionnaire. And oftentimes they will tell you on those questionnaire that, yeah, I have depression, anxiety, I can't sleep, all those issues affecting the mind. And we always say, let's start with there. Let's start with the mind. There is a description that a patient told me a long time ago that stuck with me because I think they said it the best. And they told me, Dr. A, when your mind is trapped, your body is paralyzed. And I think it summarized how they really felt. Like you can ask me to do whatever you wanted me to do, but if my mind is trapped, I won't be able to go for the physical therapy recommendation. I won't be able to go to the gym. I won't be able to quit smoking. I won't be able to do the physical things that you're asking me to do because my mind is trapped. And that's a very accurate description for people who are dealing with a chronic pain condition. And we see it when a friend or a family member they're having severe chronic pain, they don't want to go out with you. They don't like socialize. They stay home. And that's the mental being mentally trapped.
That's a very powerful statement and so accurate. What are you doing at Royal Spine Surgery now to incorporate the mind body to really address that mind body connection in chronic pain?
So understanding all of these connections, obviously with working with BTL, then January of this year was the big launch for the ExoMind, which was actually, in my mind, as a revolutionary technology. I mean, I had a chance to work with it for a few months prior, but when the ExoMind came out, it was kind of like, wow, we now might have an answer. Because in the past, my answer to those questions or to those concerns was there was only limited options I could offer that are not medications. And patients,
Right.
they don't want to take pills. They already take enough pills. The last thing you want to do is give him more pills, right?
Right.
With the side effects and everything else. So then the only thing we'll tell him is, well, try meditation, try maybe listening to music, maybe cooking classes, things that might help you relax and kind of like release, so you can actually your mind, you need to empty your mind, lighten the burden in your mind. Easier said than done though, right? Because we're not in their shoes, right?
Totally.
Very easy for me to say it. And every time I told my patient those recommendations, I'm like, man, it's easy for me to say it, but how are they going to do it? Are they really going to do it? And when they try to do it, do they really enjoy doing it, right? Next, when the Exomind came out, it was kind of like this Christmas present for all of us that we were waiting for, right? And when they landed, we're like, wow, this is now something that we can offer patient that is not medication, that is not pills, that is directly working on the brain cells rather than, try doing different things. And the way I view ExoMind with the other modalities, meditation, relaxation techniques, swimming, dancing, whatever, the way I view it is similarly to what I say with the muscles. ExoMind, in my opinion, is kind of like I'm going to go back to the dental work, the dental world using
It's a
another
great
example.
analogy. Bring it.
So when you go to the dentist, there are three things. There is brushing teeth, deep cleaning, and then let's work on your teeth, root canals, and so forth. Root canal is the surgery, and the brushing the teeth is the stuff that you can do on your own at home. Exercise, physical therapy, meditation for the mind, reading a book, solving a puzzle. But the thing that bridges the two, which is the deep cleaning, for muscle, that deep cleaning is Emsculpt Neo. For the mind, that deep cleaning is ExoMind.
I like it.
And, and that's how I try to portray to my patients is that, you want to brush your teeth daily. You want to maintain a routine or a discipline, I should say, where you're actually actively working on your mind wellness, whether that is scheduled meditation, scheduled yoga, anything that you feel relax you. Listening to 30 minutes of music, if that makes it better for you, by all means. But then the ExoMind is that tool that allows to do that deep cleaning of all the junk that stick to our head. TikTok, YouTube, social media, junk food here and here, commercials, kids running around. chasing your kids around, going to Disney World, thinking there's going to be a great vacation, only to find out that, you're just chasing your kids around a big park. All these things that just sits on your mind. And look, how do I deal with it? Like a single sit of meditation might not do it, but a single session of ExoMind, when you have now technology that is actually stimulating the actual brain cells, the actual part of the brain that is involved in regulating those function, mood, executive function, cognitive function, that becomes powerful. And we didn't have anything like that. I mean, we had TMS, but we didn't have the means to do it in the way ExoMind has allowed us to do, which is the convenience for the provider, the ease of use on us, but also the convenient on the patient. Like there is nothing like you walk in, you lay down, you're not even strapped, you close your eyes, you can fall asleep, and all you hear is a little just tap, 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 and 30 minutes later you sit up and you're like, wow, I feel good. That is
Yeah, no,
very powerful.
it is truly revolutionary. And for our listeners who aren't familiar with ExoMind is the leading innovative device for TMS, which is transcranial magnetic stimulation. In the past, typically the association with TMS has been just for treating depression or
Yeah.
treatment-resistant depression. But what ExoMind has done has brought it into the mainstream and allow us to use it for so many different applications. And I think this chronic pain application it's one of the most exciting fields in the way that ExoMind can be applied. So I love that you're using it in your practice day to day, and that we can use it for treating chronic pain, and even before it gets chronic, before it becomes something that is, this vicious cycle that we all can spiral on. So I love seeing that in your practice.
Yeah, and honestly, I think what ExoMind has the way ExoMind has changed at least how we view wellness and health in general is that it allowed us to tie into whatever part of medicine we're doing, tie into it the mental mind component that oftentimes was ignored by the non-specialist, right? And only was given to, listen, you have mental health issue or you have some issues with stress, anxiety. Let me give you a few pills and maybe send you out to someone else to dive deep into it. But ExoMind has allowed us to actually incorporate that part and make it part of our daily evaluation and assessment because it was there all along. We just didn't know how to tackle it. And now I think of it as the anchor. Like I'll use an example. I want to talk about, for example, Emsculpt, which is the chair. It's a different thing, right? Obviously for pelvic health. But let's talk, for example, people who have, let's say, erectile dysfunction. If you have erectile dysfunction, it is you're almost guaranteed as clinicians, we know for a fact that having erectile dysfunction will have impact on the mental well-being of that individual. There is lack of self-confidence. There is maybe a feeling shame. There is negativity that comes to it because they have that condition, right? You can now use ExoMind as the anchor by enhancing those treatments. So if you're someone who treat patients with erectile dysfunction, now it's not just about giving them the medication pill or the shock wave therapy to try to help them. You can actually address the mental component because sometimes that might be actually the biggest hurdle that's stopping them from having positive outcome from the other therapy. So it has become an anchor. So now we look at this as ExoMind as the anchor outside of just pure mental illness and use it to complement whatever part of the body you're targeting. If you're doing like physical rehab or physical exercises or program, like with the Emsculpt Neo, you anchor the ExoMind to try to bring the mind component to it. If you're doing MSALA for pelvic floor condition, erectile dysfunction, incontinence, and again, incontinence will also have consequences for people who have it. Mentally, they're going to feel like I'm embarrassed of it. Sometimes they don't even talk about it, right?
Right.
So it has become this anchor, and I think 2025, because the technology came in 2025, we moved from viewing these technologies, or at least dealing with these conditions, as a single treatment episode. It's no longer about single treatments. It's all now about combining these treatments for a true, complete functional wellness. And mind and body becomes part of it. So it's a beautiful device because it anchor all these other modalities and allow you to actually achieve better outcome, even in the area that you're just working on.
Yeah, that is so well put. And it's something, like you said, that we've needed for so long. We always, as physicians, have known that that's there, but we never had a tool. We never had the power to treat people the way we can now. And for me, that's been, so life-changing in the way I treat my patients, and to see these outcomes has been inspiring. I always say, like the same way you say for Emsculpt Neo, everyone's a candidate. Well, everyone is a candidate for ExoMind too. Across the span of our lifetimes,
Yeah.
there's so many applications. So it's just great to see how you're using it in your practice, and how so many other doctors across the country and across the world are now incorporating that. So what is one of the things that drives you crazy about what people believe about back pain? What do you wish that they could know or do differently? Because it comes up all the time in my world, and I know in
Yeah,
your.
yeah, well, it's funny. I mean, I can already tell you what it is. I call it looking beyond the scan. What do I mean by that? We see so many people referred from by doctor friends that come for back pain, and I'm not kidding. Before I even walk into the exam room and I say hello and I sit down, the first thing that patient will say, Doctor, have you seen my MRI? And to me tells me that we've been programmed that MRI tells us the whole story, and that everything we see on that MRI, we will use as a scapegoat and use it to blame why they have pain for. So they'll come to me and they say, "Oh, but my doctor told me I have a disc bulge. Oh, but my doctor told me I have, bone spurs or arthritis." So they make the immediate association that because an MRI showed something, that's why they have the pain. Oftentimes, I tell them what the MRI is showing us might not actually tell us where your pain is coming from. And I use the example, not every mole on your skin is cancerous and you need to take it out. Not every bone spurs we see on your MRI is a pain generator that we have to drill out or clean out and operate on. And that I think what I call, looking beyond the scan. And that's what I tell my patient. If you're here for me to just review an MRI and make a decision based on the MRI alone, then I can save you the trip from driving all the way here because I can look at an MRI remotely and tell you what it shows. But oftentimes the MRI is just a map. We still have to correlate the symptoms to see if it makes sense or no. And the best part is when that scenario happens, and then I pull up the MRI, and then I show the patient. Well, I ask the patient, "What are your symptoms on which side?" They say, "Well, it's affecting my right arm." I was like, "Perfect." So he said the right arm. Left is good. Left is good. Pull up the MRI, and I literally show the MRI. This is right. It says R. This is left. It says L. And let's go through this MRI together. And then I show them where the nerve is pinched or there is narrowing and say, "You see the narrowing here is on that side, and that says left. How come your left doesn't bother you? But the
I
right is
love.
open." So
Yep.
then they understand, oh wow, yeah, I guess I see your point. I'm like, see, if I were to just use the MRI alone, I would give you the wrong surgery. I mean,
Yeah.
it's the right surgery to fix the MRI, but it won't be the right surgery to fix your symptoms because you're gonna wake up from surgery and say, "Doctor, I still have the same pain." So that
Yeah.
is one thing that I won't say it drives us crazy, but it just shows me to what extent we have, as a society, we've become dependent on images and that
Yeah.
the picture drives the decision.
Love that you're saying this, because I say the same thing in my practice all the time, and we see it as well. And, I tell patients they can, we see you, I know, see this all the time because I do too. You see the most horrific looking MRI and the patient feels
Yeah,
totally fine, as you
yeah.
were saying. And then the inverse also happens. So, explaining to patients, we're not treating the MRI, we're treating the person in front of us. And I think that's the nuance and the art and science of medicine that gets lost with this over reliance on imaging, as you're saying. So I like that you're validating what I've been saying for many, many.
Yeah, and to be honest with you, I mean, if it doesn't make sense, because at the end of the day, what separates us from, let's say, like, AI An AI can look at MRI now and can give you like a list of all the diagnoses that the MRI could possibly, tell you the patient might have. But the AI doesn't examine the patient, at least not yet, to try to like, tell you that, yeah, based on these symptoms. I mean, I guess at some point you can enter information yourself, but that means you still have to examine the patient to enter the information to the AI for them to understand that. But it's always here is another one that usually comes up, and sometimes they say, "Oh, doctor, but so you're telling me that I don't need surgery. I mean, everyone said I need surgery. I saw all these doctors and they sent me to you because they said for my pain, I'm gonna need surgery, and that's the only solution." I tell them the MRI doesn't make sense. It doesn't explain it. So if it doesn't make sense to me, then I won't be able to offer the surgery. And then I have to remind them that there are times when we're going to see patients who might have conditions and symptoms that we might not have clear explanation for. And that's okay. There is nothing wrong. And I'm comfortable telling my patient, listen, I truly don't understand. I'll work and try to figure it out, but I'm not going to rush into doing just treatment to fix an MRI. And I use the example of, does everyone with headache require brain surgery? No. How many people walk with headaches with completely normal brain images? But that doesn't mean they don't have headaches. That doesn't mean that we can't manage the headaches. But just because your headaches is not getting better with conservative treatment, I don't see patients coming to me for chronic headache from neurologists and family doctor or referral doctor say, listen, we've done everything. It's time for you to look at their brain. You see,
Right,
we get it all the time for the spine. Why? Because you're
right,
going to see the athletic changes as part of this, the age-related changes. But it
right.
would be the same idea for me. Why don't you guys send me patients for the brain? Because their headaches is not resolving after all these therapies. Say, well, now you need time to send you to the neurosurgeon because maybe you need brain surgery for your headaches,
Can you imagine?
right? And patient didn't appreciate that. They say, well, that makes sense. Now I understand what you're going with this is that not every pain requires surgery.
Yeah.
But that doesn't mean not every pain is real,
Right.
right? So,
Right. And I think, and that's a very good point. And acknowledging people's pain and the way people perceive pain so differently. The same exact injury in one person is perceived so differently in another. And, I explain to patients that pain, the way your brain perceives pain is very unique to you.
yeah,
And it's really remarkable to see these differences. And that brings back that whole mind body connection
yeah.
in
So it's fascinating. Yeah.
yes. All right. So we're at the end of our time. We're going to do a couple fun rapid fire questions to get to know Dr. A. So just real quick, I'm going to ask you just like 5 or 6 questions and just whatever comes off the top of your head. So first thing you do after a long day of surgery, what's your favorite thing?
Go on my phone and pull up ESPN app and just follow up on the score results.
What's your favorite team? What's your favorite sport to follow?
You you know what? It depends on the season. I'm a big fan of college football. So now that the college football season is starting this weekend, the fall is the best season for me because of college football. But then I'm a big fan of MMA, UFC.
Oh,
Right?
all
Yeah.
right.
So,
Okay. Fun.
yeah.
Okay. What's your dream vacation spot that you haven't been to yet?
A vacation spot that I haven't been to yet?
Yeah.
Oh gosh, there's a few. I would love to visit Japan and the Asia in general. I haven't been there, so that's on my bucket list. Yeah, I would say Asia. Australia, I also haven't been to Australia. So those are the two areas that I would love to visit.
Nice. Favorite coffee order?
I don't drink coffee.
What? Okay. Tea? No
I don't drink.
caffeine? Oh, you're
You
such a
know what?
okay,
And
what
it's
is it? Very unique. Okay. Now I know
yeah.
what to get you for Christmas. What's one gadget in your office that you could not live without? A non-medical, not a device, like something that you use every day.
Does the laptop count? Because I can't live without my laptop.
Yeah, that counts. I would probably say the same. If you weren't a spine surgeon, what would you be doing?
If I wasn't a spine surgeon,
Yeah.
I would be a photographer.
Nice. Okay. I'm going to look
Yep.
through your camera roll next time we're together.
I used to enjoy doing landscape photography during residency, and I had some time. Now it's really hard, but that I probably would have done that because I just love traveling and taking picture of the landscape, in the nature. So that's what I probably would have done.
Okay, I love it. Well, thank you so much, Dr. A. This has been so much fun. I always love talking to you. I can't wait to see you again in a few weeks. And it's just been an honor and a pleasure.
Well, thank you for having me. I know it's been a while.
Thank you, everyone, for listening. This is Dr. Mohammed Abdul Hamid, world-renowned spine neurosurgeon. And again, an honor and a pleasure. Thank you.
Well, thank you. I'll see you soon.
Thanks for joining the Kind Revolution. If this gave you something real, hope, perspective, or a fresh way to think about health, please share it, subscribe, and pass it on. Medicine won't change on its own, but together we can reimagine it and build something smarter, kinder, and create a system that truly heals. This is the Kind Revolution with Dr. Nanos, where science meets compassion and the future of medicine gets brighter, one conversation at a time. Thanks for joining the revolution.